And this is medical emergency. A man has been travelling for an excruciating 40 hours.
I don't want to see it.
To get medical treatment for his badly broken leg.
It's nice to know. Talk to the doctor and he knows what they're talking about, and it's quite reassuring.
A 79-year-old woman has been hit by a car.
So you reckon this is where you hit the turf?
I did.
And you got a bit of a bad cut there.
And she's about to get her first ever stitches. And a truckie's blacked out and driven through the back of someone's home.
Did you have chest pain tonight or palpitations? I can't really remember.
Could whatever caused the crash be threatening his life?
15, go ahead.
In Sydney, a man has come straight from the airport after an agonising 40-hour trip to get medical help.
Who's with you? You've got family with you?
My friend Brett.
Friend. Okay. What's happened?
I live in the Marshall Islands, and on Sunday I was playing soccer and a clumsy challenge, someone came through me and my whole of my ankle just went the other way and the ankle bone jutted out, and they tried to operate on it there in Majuro. Concluded that they couldn't pin it or anything, so then I've come here.
Okay. Right, once we've got these morphine in and a little bit more settled, then we're going to take down the bandage and have a look at it.
I don't want to see it.
That's fine.
This is a pulse.
Yep. So we're going to cover that up with a clean dressing and talk to the bone doctors. We're going to leave that back slab on there at the moment to give that ankle some support. Does that all make sense?
Yes, it does. It's good to know I'm in secure hands, that's for sure. I just want to get the bones set because it's been such a long time. It's been ages since it broke, so it's just...
Finn's accident was 2 days ago. With the bone broken through the skin, he runs a high risk of infection.
I'll give you some more morphine for that pain.
Back in Sydney, Finn has just travelled 4,000 kilometres from the Marshall Islands in the middle of the Pacific Ocean with a badly broken leg.
Can you tell me a bit about what happened?
I was playing soccer and it was just an accidental but clumsy challenge, and someone came through on my leg and completely took the foot away, and compound fracture where the ankle came out the skin.
So like it was poking out, essentially, okay.
Yeah. All the ligaments have been ripped off as well, unfortunately, and dislocated ankle.
And when did this happen?
Sunday, 11 o'clock in the morning. My worst fear was actually not knowing that where I was going to get my treatment, and it felt like I was going to get stuck in the Marshall Islands, not being able to be flown out.
Alright, so we've got a fracture dislocation of the ankle. So we've got the tibia, and this is the fibula. The fibula is fractured along the shaft, and the ankle is dislocated. It's a fairly nasty injury. He's certainly going to need surgery for this. I'm just a bit worried about the cellulitis running down his foot. That can indicate that there's an early infection there, so we'll just have to keep an eye on that. I know you're not going to be happy with this, but I just had a chat to Dr. Turnbull, and I think sensibly, because you have that early cellulitis there, which is essentially evidence of an early infection, he thinks that we need to treat that with antibiotics first before we go doing the formal surgery, putting plates in, because the plate is a foreign body, and if bacteria get on a foreign body in your body, then it's going to get infected. I mean, the bacteria cling to it, they reproduce on it, and then you end up with an infected...
So how long will it take to get rid of the infection?
Well, we'll assess you daily, and as soon as the erythema, the redness gets out of it, we can go ahead, but it may take a couple of days. Yeah, but you get a full-blown infection here, and then we go and implant foreign bodies in there, then you stand the chance of losing your leg. So I think it's better that we delay it a couple of days, get it right, and then proceed to the formal operation, okay?
Yeah.
In Sydney, it's been 10 days since 30-year-old Finn flew in from the Marshall Islands after breaking his leg in a game of soccer. His wait for surgery has been long and lonely, so the arrival of his mum from the UK is a massive relief.
It's good to see you.
Yeah. All right.
Yeah.
Hello, how are you going?
Good. I'm glad you're here.
Well, hopefully we'll get you sorted anyway.
Yeah, it's been a bit of an ordeal, really. Once I was here, I thought everything would be all right. 10 days later, I'm still here, and I can't do anything. So it's just been a bit traumatic, actually. And it's just really nice to have Mum here.
Well, it's been difficult because depending if he's just had a shot of morphine or whatever, it's difficult to know exactly what the right information is sometimes. I was meant to go there this week to visit him, so I've had to change just a little change of plan to come here instead of going to the Marshall Islands.
Fingers crossed.
And 16 days after arriving from the Marshall Islands, Finn was finally cleared of infection and taken to theatre where doctors fixed his broken leg.
He'll stay in the hospital for a few days on an IV drip with some antibiotics, and when his wound's good, I'll let him go home.
Rest your foot just gently on the floor.
He's now fully recovered and making plans to bicycle solo from Alaska to Mexico.
Walking again. At last. 3 weeks to the day. It was brilliant.
Next time on Medical Emergency. After 50 years on the job, a carpenter has just made his first big mistake.
As it kicked, it just ran straight underneath the thing. No, I think it's on his skin holding.
A stoush in the playground has put a 10-year-old boy in hospital.
Here's what happened to you. Here's what crazy.
And just when life couldn't get any better, a beautiful young woman has driven into the back of a truck.
And she's obviously hit her face on something really, really bad because she's just smashed all her jaw